The next theorist I wanted to present is Albert Ellis, who I have between Carl Rogers and Fritz Perls. Some history. Ellis was born in Pittsburgh in 1913 and grew up in New York City, where he attended City University of New York, receiving a PhD from Columbia University later in 1947. He was the oldest of 3 children and was sick and hospitalized 9 times during childhood, mainly for problems related to kidney disease. His father was always away, and he says his mother was neglectful of her family. Ellis, as time went on in his work, became dissatisfied with psychoanalysis, and he turned instead toward his interest in philosophy, trying to figure out and determine ways to help individuals carry out their philosophical point of view and develop ways of combating self-defeating behavior, as he labeled it. Ellis favored one of the Stoic philosophers, particularly this observation by Epictetus, who wrote, "Men are disturbed not by things, but by the view which they take of them." So this is a very early idea that we are influenced by how we perceive what we experience, whether it be the reality in the eyes of another person, or the big R reality versus our little r reality that each of us has in terms of how we take our experiences in life. Other philosophers that influenced Ellis were Spinoza, Bertrand Russell, who were around his time and are just before that in terms of the history. Actually, Spinoza was quite a while before. Anyway, he favored rephrasing Epictetus's observation using William Shakespeare's Hamlet, which suggests there's nothing either good nor bad, but thinking that makes it so. So again, our perception of things. So this is a central element of what Ellis's approach has to do with. He favored Alfred Adler, who was a contemporary of Sigmund Freud, and his SOR theory of human disturbance. Ellis tended to like to use the word disturbance a lot, as you will watch if you see his videos. The suggestion here is that no experience is a cause of success or failure. We do not suffer from the shock of our experiences, the so-called trauma itself, but we make out of them just what suits our purposes. That was one of Adler's assertions, which Ellis incorporated in his own approach to therapy. We had Rational-Emotive Therapy was his first take at this approach, and then he added behavior later on as we move towards the focus on cognitive behavioral work. Rational-Emotive Therapy was the result of his search for a method. His previous training and clinical experience, logical and scientific thinking, originated around the psychoanalytic approach. However, in 1933, he changed the name of Rational-Emotive to Rational-Emotive Behavior Therapy because RET had always stressed the reciprocal relationship between cognitions, emotion, and behavior. So he suggested that a choice is reached through a highly cognitive process whereby individuals condition themselves to think and act and emote according to their idiosyncratic belief systems. Again, this whole perceptual idea, the perception of things, the perception of the world around us and our interactions with individuals and things and even our pets, perhaps. For instance, when I was a young child, around age 2, I was bit by a dog, and I have had fear of dogs based on that unconscious experience. I don't remember the event itself, but it certainly has set me up. And he says that that is whatever individuals believe to be true about a certain event or condition governs their emotional reaction to that situation. Ergo, big dog, I experience fear when I observe one. So the key to his therapy is what he says: the goal is philosophical reorientation of the person and personality change That is to internalize rational philosophy of life just as the client originally learned and internalized the irrational views of his parents and community and other experience, like in my case, dogs. Ellis then goes on to say, REBT helps clients accept and accomplish the following 4 features: a healthy outlook towards oneself, which some people take years to be able to arrive at, a healthy outlook towards others, a healthy outlook towards reality, and a healthy outlook toward the future. So there's a future element in all of this, that if I have an event that happens now, will similar situations in the future trigger the same response or experience. Therefore, looking at irrational sorts of attachments to future events based on one untoward or negative past event. So the key concepts that Ellis posited were this ABCDE construct. A is the activating event or the antecedent experience, then the belief about what one has just experienced based on one's personal way of looking at the world, and then the consequence. So if I do X, I will have this response. So there's sort of an intentionality connected here too, in terms of your belief leading to the consequence of whatever the experience or behavior might be. And then he would use the dispute element, where one develops irrational beliefs, and that's one of the areas Ellis targets in his work with individuals and groups. And then the last, the E, has to do with the effects or of the disputing process. So you have an irrational belief, and Ellis would try to dispute that belief by having you look rationally at the situation, at the precursors and the consequences. Ellis was also one who gave homework to his clients. It was a common part of REBT. Members are assigned an emotive task such as rational emotive imagery when they encounter an experience between therapy sessions. The assignments outside are important in helping irrational ideas, inappropriate emotions, and self-defeating behaviors that may be temporarily changed during the group session and become more permanent through the reinforcement of continuous and successful practice outside of the group setting. This is also, by the way, what Ellis used in individual therapy as well. He would work individually as well as with groups. And then he tagged what he called the 3 basic musts, this sort of expectation about how one should be responded to in the world. He called it masturbatory thinking. For instance, I must, should, or ought to perform well. I must perform well. You must treat me considerately and fairly. Considerately and fairly. So my expectation is that response. And when I don't get that from the other person, it causes some inner conflict and perhaps conflict between myself and the individual I expect to treat me exactly like that. And then conditions must be the way I want them to be, and it's terrible when they are not. I can't stand living in such an awful world. It's an utterly abominable place. So here we have a lot of, again, judgments in terms of our perception of how we have encountered the world around us. So the word rational, he says, refers to people. 1, setting up or choosing for themselves certain basic values, purposes, goals, or ideals. And 2, using efficient, flexible, scientific, logico, empirical ways of attempting to achieve such values and goals and to avoid contradictory or self-defeating results. So this is what he would talk about in terms of the rational element of his therapy. Rationality and irrationality were words that he used somewhat frequently. Rationality suggests good goal-enhancing behavior. So what I'm doing is reaching or drawing me toward my goal, where irrationality is what he would construe as goal-defeating behavior, or a word he also used in context was hedonism. In other words, seeking pleasure and happiness with low frustration tolerance, which can be self-defeating, because one does not allow a lot of time to have a response, but is frustrated without an immediate response to whatever it is that they're trying to accomplish. Then he talks about the therapist roles and techniques in REBT. He sees the therapist as active, directive, and authoritative. No question who's in charge of the experience or the session in terms of the therapy. The goal is to assist members in minimizing emotional disturbances and self-defeating behaviors by acquiring a more realistic and workable philosophy of life. So here you see he's talking not only about irrational thinking, but one's development of a philosophy of life that allows them to not be troubled by their way of perceiving the reality around them. Members learn to challenge their irrational assumptions and beliefs to engage in alternative behaviors that are goal-enhancing rather than goal-defeating. He talks about disputing irrational belief, or the DIBS technique. Here he talks about mental imagery, bibliotherapy, and teaching as learning can be used in numerous ways. So he's looking upon this as kind of an educational experience as well. I mean, I know we've later had the term psychoeducational coined by someone else who does workshops and training, but he actually uses this concept as part of his therapeutic experience. And he talks about unconditional acceptance must be conveyed to members at a feeling level. So this is some of the elements that you saw in Ellis, and certainly in Scott Miller's work, that unless there's unconditional acceptance and the sense that the client gets that, there's difficulty establishing some kind of rapport within which to work. Again, separate the person from behaviors and attack irrational beliefs that cause the individual's problem rather than attacking the individual. And again, role-playing used to evoke feelings. Ellis did a lot of role-playing with his clients as well, for them to practice the change in approach to their way of responding to reality. The therapist's modeling is effective in producing a feeling of fairness and congruence. And again, we hear this congruence concept in several other therapists, including Carl Rogers. In terms of his look at it, was congruent feelings. Which is what Ellis is alluding to here as well. Imagery used as a cognitive technique and an emotive one. By generating images or closing our eyes, we have an emotional response a lot of times to the images that we encounter. And shame-attacking exercises in and outside individual and group work to combat feelings of shame and humiliation that can accompany other feelings of inadequacy and serve to increase anxiety. So, addressing this whole concept of people feeling shamed and having them look at it from a slightly different perspective is another one of Ellis's techniques. Then he talks about the group process, which is in addition to his individual work. Because as social workers, we have the opportunity to do more group work, and sometimes it's more beneficial to work with individuals in groups as opposed to in individual therapy. He developed workshops, family groups, marathons, which would go on sometimes for the course of 24 hours, or general weekly sessions. He suggests the therapist maintains control over the process and acts as a supervisor to the helpers. This is kind of a summation of Ellis's work. I hope you'll look at the videos that are produced for this week as well.